Welcome to my show about seniors and topics that concern seniors. I'm Janice Wood. I am an insurance agent, and my specialty is Medicare, and I also do regular health insurance. I do Medicare Advantage plans, I do supplemental plans, and prescription drug plans. Over the last 2.5 months, I started this show. I've had several different people on talking about health issues, insurance issues, from property and casualty to life insurance, wills and trusts, exercising, and a couple of people on health issues. On July 9th, I had Dr. Amber on, Dr. Amber Voitenko from Voitenko Wellness in Tustin, California. And she is a chiropractor, and she is interested in the immune system, hormones, nutrition, a lot of other things. I always thought chiropractors just work with the alignment of the body, but I learned over the last several years that chiropractors have specialties, and Dr. Amber specialty is all those things that I just mentioned, but other chiropractors have stem cells specifically for a specialty that they do. So chiropractors do a lot of different things besides alignment of the body. So when she was on July 9th, we talked about the immune system. Today, we're going to talk about the immune system and hormones. And I know I've throughout my whole life, I've heard about hormones. I knew that it affects your growth. I know as women, as a woman, I remember going through puberty, going into the menstrual cycle, and then going through the whole thing, going into menopause and how it affects us, how we have mood swings. And even as seniors, the hormones are still very important to our bodies. I did a little bit of reading, and I'm more confused than I was before I started about hormones, because one article said there's 4 different types of hormones, and another one said there were 5 different types of hormones. So that's what we have Dr. Amber here for, to help us learn about how hormones affect us. Now, I have a question for you, Dr. Amber, before we go into this, okay? My question is that, how did you become interested in this form of chiropractic? I know your office does adjustments, because I've come in and I get adjustments done by you or your other chiropractor that works in the office with you. But I know you like working with the immune system, hormones. Before COVID-19, you put on classes in restaurants. Mm-hmm. You did little seminars.
Yes.
And now you're doing the seminars on Facebook.
Yes.
On podcast. You're other people's guests.
Yes.
So how did you get to like this? And
Yeah. So, well, first off, I want to say, Janice, thank you so much for having me back onto your broadcast. I appreciate you. And this is a very important topic. Again, Janice did a great job on introducing me and how I got into this. I am a doctor of chiropractic, but we look at the body as a whole. So we do holistic wellness, holistic care. And so my passion, mainly due to being in a European family who did things very naturally when we were ill or sick, or we wanted to prevent. We were really big on longevity in my household, my grandparents. And so that being said, it was a very natural approach to problems with the body. Everything from essential oils to vitamins and minerals, teas and food. But that being said, then I went into work for chiropractors, and they were actually more into wellness, the holistic approach to that. So I already had that knowledge. I already had that liking. I knew that if you give the body the tools, it has the innate ability, to heal itself. And so my niche, though, when I went into chiropractic school, I actually got into sports medicine. And then in about 2 years of being in school, I then went into what is called applied kinesiology. Anyway, at that point, I really went into the physiology, the chemistry of the body, and I had already studied nutrition prior to chiropractic school. So it made a lot of sense in regards to not just handling the nervous system, the central nervous system, the musculoskeletal system, but also helping people with the nutrition end. What I'd like to lead into from that comment is that my niche, 3 years into practice, became balancing hormones naturally, mainly because most of the patients that I had were women. And so women were coming in with headaches, they were coming in with digestive issues, they were coming in with PMS, premenopause, postmenopause. They were coming in with the inability to hold pregnancies. Some of you might have heard of polycystic ovary disease. So cysts on the ovaries, fibroids, fibrocystic breast disease. So that being said, when it comes to what's happening now in our environment, more and more individuals are becoming more interested in their immune system and how it relates to their own health conditions. And because I treat many people in regards to balancing hormones naturally, that plays a huge role in your health, in your immune system, and your overall wellness, really longevity, disease process, cancers, you name it. So what I'd like to do is start with a couple tidbits. The important thing is a lot of people like to dive in and get very technical, but I'm going to be pretty simplistic. I know we don't have a lot of time, but I want to hit a few key points. One thing that Janice and I were discussing was, estrogens, progesterones, testosterone. And one thing I want to let everyone know, because I think it's really important when I'm evaluating a patient and we look at blood work, we look at it functionally. We also, though, look at one very important thing, and it's the gold standard of actually checking hormones and hormone levels, and that is saliva testing. And it's very, very important because people think, oh, I got a blood test and that's telling me exactly what's happening. When really the gold standard for checking estrogen, progesterone, testosterone, as well as the function of the adrenal glands, which I'm going to talk about, is saliva testing. So just want you all to know that that's important. So if you're really wanting to get to the bottom line, if what you're doing is not helping you, you can reach out to me at Voitenko Wellness. I'm on Facebook. info@voitenkowellness.com, and we can give you that data because it's very important to evaluate those levels and then come up with a plan on how to balance the imbalanced hormones. So why I want to bring up, okay, so you've got estrogens, which estrogens have actually been found to be very beneficial when it comes to the immune system. So for women, when the estrogen levels drop, that affects us. It affects us as far as disease, longevity, and symptoms like Janice was talking about, mood swings, night sweats, hot flashes. I mean, you name it. Libido problems, energy problems, also a lot of times even weight. So balancing estrogens is important. Now, we're talking of 65 and older, right? And so when we're talking at that demographic, it is important to look at those hormonal levels to determine not just for your immune system, but longevity, because estrogens and progesterones together, as well as the testosterone, is a balance of making sure that you have enough muscle mass tissue, that your nervous system is functioning properly, along with the systems of the body. And we're talking specifically of the immune system. So when estrogens are lowered, which happens after menopause, what occurs is the immune system can become greatly affected. And that's why individuals, when you are going into 65 and older, we talk about their bodies being more immune compromised. So of course, diet comes into play. Nutrition, is a huge part of this. And evaluating those levels so you know. Now, let me give you some of the solutions, and then I'll go on to the next thing. So there are many different natural solutions. Myself being a chiropractor who is basically in my clinic as a wellness practitioner, I use natural methods. I don't take anyone off of medication. I don't put anyone on medication. So the availability that we have as doctors of chiropractic is we do a lot with creams to help balance hormones. With the measurements from the saliva testing and blood tests, we can help individuals with these creams, as well as different herbs and glandulars. And what glandulars are supplements. The difference is people say, well, what's the difference between a supplement and a vitamin? Because in a supplement, there could be vitamins, but why they call it a supplement is because it's food or animal based. So glandulars do happen to be animal based, but there are glandulars that are herbal. They don't really call them glandulars. Now they're an herbal formula, but they're supplements. Very important in balancing hormones. So that's that solution. Hopefully that gave you guys some good information with the saliva testing, the fact that those levels are very important to look at. If you're looking for increasing your immune system, if you're looking to increase your longevity, anti-aging, which is part of the whole immune response, really, if you look at it, it's an immune alliance, which we talked about before on Janice's show here. So anyway, that being said, that's what we're looking at. Now, the other thing I mentioned in that saliva test are your adrenal glands. And I really want to hit hard on this because no one talks about the adrenal glands. We talk about estrogen, progesterone, testosterone. We talk about the thyroid. Thyroid plays a really big part in the immune system, but we don't really dive into those adrenal glands, Janice. And you know what the other name for adrenal glands are?
No, I don't. Please.
That's right. So they are called your stress glands.
Your stress gland.
Your stress glands. So guess what? Stress.
Okay.
Stress.
All right.
So what is the number one killer? What is the number one thing that brings the immune system down that we all talk about? Stress. Right. So that being said, stress glands, in my personal opinion, your adrenal glands are so important. There are no medications for your adrenals. So you don't really hear about them a lot when you go to the medical doctor, which is fine. They practice medicine. They have their methods, but adrenals deal with the stress on the body. So there's physical, chemical, and emotional stress, right? When the adrenals, the stress glands, are not doing well, they put the body in fight or flight. That means anxiety, heart irregularity, problems sleeping. I mean, you name it, problems with digestion, because now all the blood from the gut is going into the arms and legs. Well, that is not good for your immune system. If someone is constantly in this situation, they're going to have trouble. They're going to have trouble with their immune system, trouble with their digestion, which is going to lead to disease potentially, trouble with sleep, which can cause havoc on a woman's or a male. These are male hormones too. Right. Males have adrenal glands, so it can affect their weight. It can affect their sex glands and sex hormones. So the adrenals are very important to evaluate. One of the easiest, but besides the fact that I've already educated y'all on the fact that the saliva testing for the adrenals, estrogen, progesterone, and testosterone is the gold standard. To test the adrenals, one can actually do that on their own. It's a blood pressure test. So you know how everyone always just takes their blood pressure with the machines they have at home, right?
Right.
Or they go to...
They create stress for me.
Yeah. Yes. So they'll take the blood pressure at home, or they'll go to Walgreens or, Rite Aid, and they'll put their arm in the machine. Mm-hmm. So you take your blood pressure, you have the top number, which is the systolic, and you have the bottom number, which is the diastolic. So the point of this is you write down your blood pressure. Then you sit comfortably and you push the button again, the cuff starts to tighten, and then you stand. When you stand, your adrenal gland should kick in and make your blood pressure go up anywhere between 10 and 12 points. If your blood pressure, the top number, the systolic number, stays the same or goes down, that means your adrenal glands are not kicking in. So that could be a big sign that your adrenals are fatigued.
Interesting.
Right? And again, your adrenal glands control your immune system. They control how you sleep. They control your weight. Also, one thing I didn't mention that really aggravates the adrenals, and I want to bring this up right now, is pain. So when people have a lot of pain, their adrenals are very stressed. And the interesting thing is the adrenals secrete steroidal hormones. So what's that shot that you go get when you have knee pain or shoulder pain or back pain? Steroidal shots. Yeah, cortisone. So, right. So the point is that when somebody's in a lot of pain, their adrenals can be very stressed out, and then the hormones are not being released properly. So that just drives stress.
Right. So, and their high blood pressure, which everybody is familiar with.
Right. And it's all a system. All of that has to do with the hormones that are being released and communicated to the brain.
I find it so interesting that what affects, let's say, here on the top of my head can affect my toe at the opposite end of the body.
Yes, and that's a good point. So you don't realize, and those adrenal glands sit on top of your kidneys, Janice, and they communicate to the brain. And a lot of other things. They communicate to the thyroid, et cetera, but it's all a system. It all works together. And if it's not in that homeostasis, you're going to have these issues.
So those hormones are affecting all types of things that are going on in the body.
Correct. Another interesting tidbit that I want to bring up, also because this happens to be my specialty here at the clinic, I treat a lot of people with autoimmune disease, right?
Yes.
Has to completely do with your immune system. Here's the fascinating thing.
I mean, like, I'm going to use the thing almost every other person has walking down the street, diabetes.
Right. So exactly. So that point being, the hormones and the regulation of those sugars, which has a lot to do with the hormones, has so much to do with digestion and a food. And here's the thing, if your adrenals are always in fight or flight over your lifetime and they're not doing well, all the blood from your gut, your colon is going to go into your arms and legs constantly. The gut starts to have problems with digestion, with absorption, utilization, elimination, hydration. So the hormones, the second brain is your colon, by the way. So those hormones from the colon then tell the brain how you're doing. Plus, the colon wall breaks down. So now you have disease process. It has so much to do with overall health and your immune system. So it's very much related. Those adrenal glands should not be overlooked. And the neat thing is, just to empower everyone, adrenal glands can be helped and protected to help boost your support system, right? To help the mechanism of defense with virus, bacteria, parasites, I mean, you name it, by simply upping vitamin C. If you have adrenal issues, you can also do the saliva testing to see to what degree. There's herbal creams, there's glandulars and supplements. There are really great solutions to these problems that could really regulate a person's hormonal system.
Yeah, this is all really interesting, but as a senior, I see changes in the skin.
Yes.
We talked about being a shield of protection for you.
Yes.
I mean, no matter what I do, I put the creams on, I do all kinds of crazy things.
Right.
I still see my skin aging.
Yeah.
So means the rest of that means the rest of my body is aging.
Right. And aging is something that we're all up against for sure. But so a couple things I'll bring up that I find to be very effective that I've suggested for patients over the years, 65 and older. This is for the nervous system, the musculoskeletal system, in general for aging. So one of the things that I find to be very effective and a lot of my patients have success with is collagen. Collagen is very effective to take daily because that is a building block to help repair tissue. So when individuals are having trouble with their joints, their tissues, right, their ligaments, their skin, collagen is fantastic, right? The other thing is, well, there's three things. The other thing is our essential fatty acids. So very, very important essential fatty acids. They're really, really good for your skin, your hair, your nails, but also your nervous system, right? So important. Your nervous system controls every muscle, organ, gland, and tissue. And lastly, L-arginine. It's an amino acid you can get in supplements. That is very, very good for muscle mass. So weight bearing exercises, as 65 and older, people are worried about their skin. They're worried about aging. So what do they say? They say you need to do weight bearing exercise.
See, and I
So
do weight bearing
I
exercise.
know you do. You're so good with that. We're talking like doing things with balance, walking, weights, TheraBands. You know all about that, Janice.
Yeah, but I know as a senior, and I'm way over 65. Okay, I can't believe it. I mean, won't even go into that. Okay, I always, and women always have the fan,
Yes.
and
Those are called our butterfly wings.
those are butterfly wings. Okay, I like that.
Yes.
And I work really hard at working those muscles.
Yes. Well, let me ask you this though, because you've done this with your weight, you get chiropractic, Janice.
Yeah.
You handle your hormones. You do your weight training. With your weight training and being aligned and also your nutrition, right? It's fantastic. Have you found over this last year to 2 years that your muscle mass is much better?
Oh, I think it's much better because I'm working at it.
Yes.
But I notice when, let's say, I don't work out for a specific reason, okay?
Right.
And I notice that things are a little bit harder to get back to.
Yes.
When I was younger, which is the same thing with the hormones, everything was working better.
Right.
But as I'm aging, things don't seem to come back as quickly as they did when I was younger. So
Yes.
it's the same thing, but this is a lot of work because I see other members of my family,
Yes.
have the butterfly wings, okay?
Right.
And I know these hormones are just really important.
They are so important. And here's the thing, the one thing I want to mention, because it's important for 65 and older, it is very, very important to still have a regimen to create this environment for your body that you can improve, because that's what the greatest thing is about the body. You can improve it at any point. And it's of course, when we're younger, it's about prevention. It's about getting to a certain point in our lives where we're preventing. But really, in my personal opinion, 20 years of clinical experience, it's never too late to start a regimen with eating properly, getting the supplements that you're deficient in, balancing your hormones, and doing the weight training. People get scared by that. They think, oh, that means bodybuilding. It's not that at all. As you know, it's core training using TheraBands.
It's everything.
Okay, yes.
That goes into keeping your body healthy and functioning. So, I mean, like, I'm going to be 75 in not too long from now.
Yay!
Okay. So in order
to keep
up the schedule that I'm willing to keep up,
right,
I have to do all these things.
I know. Well, bodies, you got to do it. You have to take the time and put the routine in. It's a very good thing to do to take care of yourself and your body.
Right. So the hormones, because that's what we're supposed to be talking about. So I'm
correct.
Back to it. It's just such an important thing for both men and women.
Both men and women.
For both men. I know women have always paid more attention to hormones than men.
Yeah, well, so again, and I had brought it up to you, here at our clinic, we treat, I've been treating a long time. So I have families who husbands and wives come in. We have a lot of gentlemen that come in, and the topic is a lot of times their testosterone, their hormone levels, their thyroid, their adrenal glands, because they are interested, of course, on keeping their physique, their strength, their libido, and also anti-aging. There are many, and now it might be the demographic of where I practice. I practice here in Orange County. So, but I will tell you, many women, men come in and they have issues with energy, libido, muscle mass, especially in the age bracket of 65 and older. So I help those individuals, again, to go back to that saliva testing, it is gold standard for testosterone.
Now, if somebody wants to have a saliva test.
Yes.
Now, I mean, they would contact you?
Yeah, you can contact me. Now, what I'm doing right now to make it easier and financially, easy on people, especially when you're on a fixed income, right? We do now nutritional medi-calls, like we'll do a nutritional consultation and a physical wellness consultation over the phone. And right now, instead of being $120, it's $49. And individuals are more than welcome to contact our office. Our phone number is 714-730.
Well, I'm going to bring up your
Oh,
information.
you're going to do that. Thank you.
And
Thank
then
you,
they
Janice.
can
So
either
people
take a
can
picture. I'm
contact
going to
me.
bring up your information right now.
Yeah.
And
So they
also
can just
has
contact us.
It also
Now,
has my information on there.
okay, great. And I want to say this, the reason I preface, I'm not trying to create an environment where, you know, you have to talk to me, but in order for me to prescribe the saliva test, I have to have the person as a patient. But that's a really good way to become a patient of Voitenko Wellness. And then that way I can then, you know, prescribe the saliva kit.
Okay. Now, here's the information I have here and how to contact, of course, myself if you need any information on health insurance.
Yes.
I also, here's how you contact Amber Voitenko. Now, I would definitely contact Amber's office because Amber not only will do saliva tests, blood tests for you, have that done, but she does many other classes that are outside of what I'm doing here. And she has a lot of good information. And I should have asked Amber, I'm just thinking of it right now, for a list of when you are on Facebook or you're doing your guest on podcast.
Yep.
Okay.
Well, real quick, we're doing the next one 2 Mondays from now. I'm pretty sure the date is the 24th. I don't have my calendar in front of me.
And what's the subject matter?
The subject matter is stress and how does it affect your health?
Okay, so that goes along with what we were talking about this morning.
Correct.
So if anybody is interested in any of that, please contact Dr. Amber's office and they will give you all this information. If you're not writing it down, one of the things I love about all these smartphones is that you can take a picture of the screen.
Yeah.
I know I'm great at taking pictures of screens, and all the information's right there.
Perfect. And Janice, can I really quick, I just want to let everyone know Janice has helped many of my patients as well as myself with insurance needs. She has a wealth of information in regards to listening to what your needs are so she can help you figure out, as she calls it, the ABCs of Medicare, but even with health insurance in general. She's a whiz at it. She's very passionate. And anyway, I just want to thank you, Janice, for what you do for my patients.
Thank you very much. Okay, especially because now open enrollment is getting closer.
Yes.
Yeah. So I will have back Dr. Amber on again, talking some more about hormones and the immune system and the nutritional part of it.
Perfect.
Because I'm having a friend of ours on in a couple of weeks, and if Dr. Amber wants to join us, she's more than welcome. I'm having Mimi Chow come in and talk about her nutrition.
Great. She's awesome.
Okay. And somebody that I know Dr. Amber works with, and I've used Mimi's products for a couple years now.
Yes, Juicy. She's awesome.
Yeah, so she'll be on in about 2 weeks. So thank you everybody for joining us this morning. Please feel free to contact us. We love to hear from you. And I'll see you next week at 10 o'clock, where we're going to talk about seniors and their computers with an IT specialist who will help us understand how to use Zoom and Facebook and a lot of different things. Okay. All right.
Bye.
Thank you.
Thank you.